Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication used to treat insomnia. Its generic name is Zolpidem, and it has brand names of Ambien and Sublinox. Before we get into the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. So this medication is classified as a sedative or hypnotic. Just a quick note that some of the information that I share will just be information based on this class of medications in general. So the official indication for this medication is nocturnal sedation, or for the short-term treatment of insomnia. Before therapy with Zolpidem is initiated, as with most sedative hypnotics, it's important to go through a checklist to rule out that the cause of insomnia isn't something that can be treated with lifestyle modifications. Sometimes people may have a medical or psychiatric disorder that may be causing the sleep disturbances. Sometimes people have breathing disorders during their sleep, like sleep apnea. If somebody has poor sleep hygiene or they work shift work, this could be causing sleep disturbances. If somebody is using psychotropic drugs in excess, such as caffeine, alcohol, or cocaine, this could cause a disturbance in sleep as well. The main point here is just that we want to treat the underlying causes of insomnia before we jump straight to medication. Now, when a hypnotic is required, we try to keep the duration of treatment as short as possible. Long-term therapy is typically not recommended. However, we do see this in practice. Although it would be common sense to think that the goal of therapy is increased sleep, really one of the main goals that we use in terms of monitoring is to see an improvement in daytime functioning. Now, before somebody was prescribed this medication, there are some precautions that must be considered. It should be explained to patients that abrupt discontinuation of these medications can sometimes cause discontinuation syndromes. Drug interactions must be considered with Zolpidem because it's metabolized by the CYP3A4 system. So if you're taking medications that are strong inhibitors or inducers of this enzyme, it could cause increases or decreases in plasma levels of this medication. Because there is a potential for some individuals to attempt to abuse these medications, some physicians try to avoid giving these medications to people that have a history of drug abuse. If somebody was to abuse this medication, it could cause clouding of consciousness and sometimes visual hallucinations. This medication should not be used in individuals who have sleep apnea. Zolpidem has been reported to cause sleepwalking. It's also been reported to cause driving while asleep, as well as food binging while asleep. There have been situations of overdose in the past with Zolpidem. Typically, if somebody was to overdose, they would experience central nervous system side effects very rapidly. For this reason, it's very important to take the medication as prescribed by your physician. Now, after somebody is made aware of the precautions and they start using the medication itself, it's typically taken at a dose of 5 or 10 milligrams at bedtime. In the elderly population, we try to keep the dose at 5 milligrams. This medication is available as oral disintegrating tablets that you would just place under your tongue and let them dissolve. Its onset of action is 30 minutes, so people sometimes like to take the medication a few minutes before they actually get in bed. This time would be delayed slightly if the medication was taken with a meal. So after taking a dose, a patient would expect to have decreased sleep latency and increased total sleep time. The higher the dose, the less time an individual will remain in REM sleep during their night's sleep. This medication has no effect on stage 3 and 4 of the sleep cycle. Now, as with all medications, there are some adverse reactions or side effects that people may experience while using the medication. The first side effect, and most prevalent, which I actually don't really consider a side effect, but it's dizziness, drowsiness, or somnolence. This happens over 10% of the time. Between 1 and 10% of people do experience some amnesia with this medication. Some people notice that they develop apathy, others notice they develop anxiety. Some people have strange dreams, and some people experience constipation and diarrhea. Some people notice postural hypotension as well. Some other rare side effects that have only been reported in case reports are angioedema, sleep driving, sleep cooking, and even making phone calls while asleep. I did mention at the start of the video that there can be some withdrawal syndromes that occur with this class of medications in general. With Zolpidem, these effects were noticed in studies after about 4 weeks of continuous bedtime use. That's all we're going to talk about today with Zolpidem. As always, I'm happy that you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow the channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.